Well, it's great to be here. Sorry that I couldn't be here for the first speakers. I was on my way down from Sheffield, where I was at the FBU National School, which was a fantastic event. But it was great to hear from Holly, Adrian, Judith, John, and Matt. And full solidarity, Matt, with you and your members. 19 days of strike action as of last Friday, with more strike action going to be taking place if necessary. So please do take that message of solidarity back and do let members of Parliament know if there's anything that we can do to help you in that struggle. In terms of the importance of tonight's event, I think it's really important that we have the SOS NHS organising events on why privatisation isn't the answer. As I said at the FBU school earlier today, governments, regardless of political party, day in, day out, have pressure from very powerful interests trying to push them in the exact direction that we as progressives don't want them to go. So it's really important that we have fighting unions, political unions, and progressive organisations, such as the organisations represented here tonight, putting pressure on governments to do the right thing and also support them where they do get it right. We've heard from other speakers how the Tories brought our NHS to its knees in the last 14 years. We know, and we've heard tonight, that not long ago, the NHS was ranked the best health service in the world. But Tory underfunding, outsourcing, backdoor privatisation, all of these things have left the NHS in real crisis. And so restoring our NHS means ditching decisively the Tory policies that have driven the crisis. So I congratulate you on this meeting tonight and congratulate you on getting organised to ensure that that is what our new government does. We need to be clear about what has driven the NHS crisis and what hasn't driven the NHS crisis. It wasn't the NHS model of a publicly run and publicly funded system that caused the crisis. And I welcome the findings by Lord Darcy in his independent review of the NHS for the new Labour government, because he's clear that austerity has driven the problems in our National Health Service, that the appalling Tory reforms that opened the NHS to the market had a negative impact, and that other health system models with user charges, with social or private insurance, they're more expensive and less effective. And when that's the diagnosis, then the remedy, I would say, is very clear. We need a properly funded, publicly run and publicly owned health service. Our NHS is for the people, not the private profiteers. So we must campaign and work on that basis. As we've heard from our colleagues from the Socialist Health Association, the increase in NHS funding at the budget of an additional £23 billion in day-to-day spending is very welcome. That's a 4% annual increase for the next 2 years, and that increase is in line with the historic average the NHS has received since the 1950s. It's much higher than the low increases seen during austerity, which was about 1.1% growth, but far lower, and this is important, far lower than the peak years of investment during parts of the new Labour government, which is around 6 to 7% growth. So we need to step up the campaign towards welcoming that additional funding. We need to push the government to go further. And of course, I don't believe in this idea that there's no money left, as we've heard already. There's plenty of wealth there in this, one of the richest societies on earth. It's simply in the wrong hands. So we need to step up the campaigns, for example, for a wealth tax, a series of wealth taxes to properly fund our National Health Service. And that's why in Parliament I presented a petition signed by over 50,000 people supporting a call for 3 measures. Firstly, a 2% tax on all assets above £10 million. That would raise £24 billion annually. Secondly, equalising capital gains tax with income tax to raise £17 billion a year. It's absolutely ridiculous that when you go to work, you pay a higher rate of tax on your income from going to work than people who collect their income from dividends or sales do. That's not right. It's unjustifiable, and it ensures that the Treasury doesn't get the money that it should do and that it could use to turn our NHS round in terms of 14 years of underfunding. And finally, ending state subsidies to fossil fuel giants and closing the loopholes to raise about £4 billion a year. So those three measures alone could raise up to £45 billion a year, money that could be vital in order to turn our NHS into the properly funded service and public hands that it needs. Okay, I'll hurry up, only 1 minute left. In terms of insourcing then, we've heard already that the new government's committed to the biggest wave of insourcing of public services in a generation. Let's be clear, that must apply to the NHS. We see that many PFI contracts are coming to an end in the next few years, and there will be big maintenance contracts as part of those. They must be insourced. We must learn the lessons of outsourcing and prevent any more outsourcing. Private healthcare firms wrote to the new health secretary asking him to guarantee them access to NHS contracts and public money for the long term. They should be told where to go. Now, in the last Parliament, I brought an anti-privatisation amendment to the terrible Tory health and care bill to make the NHS the default healthcare provider, and that's what we need. Two final points in my last 30 seconds or so. Vultures are circling. Big interests and their useful idiots will want to use this crisis to hand over NHS to the private sector are working overtime. Farage, in one interview recently, said that the NHS needs, and I quote, a fundamental rethink. It doesn't work. The funding model, the organisation model. He says that we need a complete rethink. And of course, this is rubbish. It's not the first time he said that. And I challenged him in the ITV leaders debate back in the 2019 general election on his desire to privatise the NHS. His love affair with Trump is no coincidence. He believes in a United States model of healthcare, where they feel for your wallet before they feel for your pulse. And now we have Trump elected. And the last time he was president of the USA, we saw him talking about the NHS having to be on the table in the US-UK trade talks, and now moves towards a US-style profit-driven healthcare system that results in 45,000 deaths per year and 500,000 bankruptcies yearly is something we need to be vigilant for and defend our NHS against. The final point I want to make is a message of support. We've heard from Holly and others. We've heard from our colleague who's on strike with his workmates. A message to all NHS staff. I and others have stood with striking healthcare workers on their picket lines for fair pay. We've worked with organisations like the Socialist Health Association to push for greater funding and an end to privatisation in our health service. Let's not pretend that the staff in our NHS are the problem. It's the staff in the NHS that keep our NHS going despite the underfunding, despite COVID, despite all the pressures, despite the fact that the NHS has to mop up so many problems caused by other departments of government and in local government being underfunded. And league tables, which I reject in education, I certainly reject them in health as well. It's not the way forward. All it does is demoralise, demonise. It's a cheap trick and should be dropped. So solidarity with NHS workers, all power to your elbow with these campaigns. These are campaigns we can't afford to lose. Thank you very much.